Hi, so my name is McKenna Genty, and I'm here today from Happy Times Inc. to tell you about our new product. From the glucometer that many know and use, we have the ceratometer. And the ceratometer is used to measure serotonin in the blood. Serotonin is a neurotransmitter, a hormone within blood that is said to, the levels are said to determine our happiness per se. And so before we get to the product, we're going to talk about some facts. About 18% of the United States' population suffer from depression, anxiety, and other mental illnesses that have to do with chemical imbalances. Of these 18%, about a third of them receive treatment for their disorder and whatnot. People with anxiety, depression, and other mental disorders are 3 to 5 times more likely to be they're 5 times more likely to be hospitalized for psychiatric reasons, and they're 3 to 5 times more likely to go to a doctor. As you can assume, this is a problem. People who are being hospitalized and whatnot, and many of the people who receive treatment, it's not a one-pill-fits-all situation. You have people who have to take multiple pills at one time, or they take a pill and it has a bad reaction with the patient, or the depression worsens, and so they have to take multiple medications, do multiple tests until they find what's right for them. Our ceratometer here is designed to help lessen the process. It's there to shorten the process per se. And so what it is designed to do is measure the serotonin in the blood. How we do this with our little product we have going. We have a little pricker, and you'll prick your finger, and then you'll squeeze some blood onto a test strip. The test strip will go inside of the ceratometer, and it will give you back a reading of how much serotonin is in your blood. And that reading can be put into a log. The log can be taken to the doctor, and the doctor can evaluate the serotonin levels and see how an antidepressant is affecting a person chemically. And right here we have some designs before the product was manufactured into a prototype. And so, we have our little rectangular design. We have, the one that we have right now, a square design. Different ways that we can improve the product are also listed. That way, in the future, we are able to test for more than just one hormone. So some of those are right there. Now, the point of this product is that it is mobile. You can take it with you, take it home, and that way you're able to log the results. And that's why it is so important, because you're not having to go to the doctor so much. You're not having to do blood tests with the doctor or get evaluated as much as if you didn't have the mobile tester, the ceratometer. The product itself is very safe. I mean, if a patient is anemic, that might need to be taken into consideration, though it is just a very small amount of blood. Alternate ways of getting blood, other than the finger. If people aren't able to get blood from their finger, maybe they could use some wear on their hand where they're able to get blood. There are many, different ways to go about it. Obviously, one way to ensure that the product is working as it should is comparing results of a log to the results of an actual panel done in a doctor's office. And that will keep us up to date on, okay, maybe these results are wrong. Maybe this machine is malfunctioning because these results are really different than in the doctor's office's results. And so that would definitely need to be kept up on. The product itself is made of a hard plastic. It does require a small battery that can be put in by the provider, Happy Times Inc. We can ship batteries, and obviously there is nothing on the market like this right now, and so there is not much room for competitors. But if there were a competitor, it would probably be people who have worked on the glucometer. Because this is such a similar design, it's understandable that they may be working on something similar. Our main consumers, our main customer base, would be anywhere that a physician resides that takes care of mental illness. Hospitals that see patients regularly would be able to use them. That way they're able to check them out to patients as well as a log. They will be available to patients, but that since they cost a bit of money, it would probably need to be an insurance sort of thing, just as, glucometers can be taken care of by insurance. The serotometer would have to undergo the process for that sort of thing to be taken care of there as well. Promoting the product is also a question of interest, obviously, and pretty much what Happy Times Inc. would like to do is take the social media or, website approach, having advertisements bought on social medias and, commercials if need be. And I believe that would bring in a lot of customers because, social media, the internet, it's reaching out to a lot of people these days. And so it would be very helpful for Happy Times Inc. Packaging can be as simple as, a little case like this. That would carry the test strips and it would carry the device itself. It would zip up. That way it's easy to carry around. The log itself would have to be taken by each individual patient, whether it be in a purse. We could even make a log tiny enough to fit inside of the little case that we have here. And so that would definitely be something to expand upon, but the packaging itself would not be too complicated. The fact of the matter with this product is that a lot of the up and coming millennials and people who are growing up in a new age, it is shown that they are experiencing these mental disorders, these hormonal imbalances more frequently. And so this product fits into the up and coming medical innovation world because it's going to be useful for people that are up and coming. And we're starting to see a peak in depression in some of the older teens, 16 and 17. Some of the younger adults are starting to show more signs of depression, older adults even. And so it's good that we're bringing something to the market that's going to make people feel more secure in how their doctors are treating them. Many times people will undergo a treatment for depression and it's not the right one for them. And, their doctor is going to ask them, how are you feeling? What is this doing for you? And some doctors might not even necessarily perform blood tests because they don't feel it necessary. But this will definitely ensure the people who do receive them, this will definitely ensure that the treatment that they're receiving is either working or not working on a chemical level. And so, just vice versa, the people who are taking a treatment and they think it might not be working, but it actually is, they just need to let it, run its course, do its time before it shows actual results. We'd be able to see that on a level that does not meet the eye. And so this product would be very useful in that aspect. In another aspect too, it's going to save the United States a lot of money because actually the United States spends about $42 million a year on treatments for depression, anxiety, BPD, manic depressive episodes, etc. The healthcare for that, we spend $42 million a year. And if we're having to spend less money on treatments for these things, for these hormonal disorders, then we will be able to put more money towards other innovative ideas and towards other products that are going to help further us in the medical world. And while blood testing for hormones and other things like blood sugar are not new to the medical world, I believe that tests that will help improve the mental health of the public are new. And I think they're up and coming, and there's a lot of room for improvement and success in this innovative idea. So I thank you for your time. Have a good day.